Hi everyone, this is Nurse Anna from nursestudy.net. Today we are going to practice safety and infection control NCLEX questions. I put together a free NCLEX survival study guide to help you stay organized and confident. Feel free to download it with the link below. And if you want more resources, we have study guides and free nursing audiobooks in our store. You'll find all of those links in the description. Question 1. A nurse enters a room where a UAP is about to remove soiled linens from a client on contact precautions for C. difficile infection. The UAP is wearing gloves but no gown. What is the nurse's priority action? A. Ask the UAP to continue while you monitor technique. B. Remind the UAP to perform hand hygiene after removing the linens. C. Instruct the UAP to don a gown before handling the linens. D. Report the UAP's unsafe practice to the charged nurse. Correct answer. C. Rationale. C. difficile requires contact precautions which include gown and gloves when handling contaminated materials. The RN must intervene immediately to prevent potential transmission. Reporting unsafe practice is appropriate only after correcting the immediate threat. Question 2. A client with a central line suddenly develops chills, hypotension, and a temperature of 39.1 degrees Celsius, 102.4 degrees Fahrenheit. The nurse suspects a catheter-related bloodstream infection. What is the priority nursing action? A. Increase IV fluids as tolerated. B. Notify the provider and anticipate blood cultures. C. Replace the central line immediately. D. Administer intravenous antibiotics as ordered. Correct answer. B. Rationale. The nurse must report findings and anticipate blood cultures prior to antibiotic administration. RNs cannot remove central lines, but they can prepare the client. Obtaining cultures precedes antibiotics to avoid false negative results. Question 3. During a fire in the unit, a nurse must evacuate clients following race protocol. Which client should be evacuated first? A. A stable COPD patient receiving 2 liters per minute via nasal cannula. B. A sedated postoperative patient on ventilatory support. C. A confused ambulatory client pulling at IV lines. D. A patient receiving total parenteral nutrition via central line. Correct answer. C. Rationale. RACE stands for Rescue, Alarm, Confine, and Extinguish. During evacuation, ambulatory clients who pose a safety risk are moved first. Ventilator-dependent or critically ill clients are moved last with the assistance of more personnel. Question 4. A nurse preparing a sterile field for a wound. Debridement notes the sterile solution, bottle cap falls onto the sterile field. What is the best action? A. Leave the cap on the field because the inside is sterile. B. Remove the cap with sterile forceps and continue. C. Discard the sterile field and start over. D. Ask another nurse to hold the cap while you pour. Correct answer. C. Rationale. The outside of the cap is non-sterile. Once it touches the sterile field, the field is contaminated and must be replaced. Question 5. A nurse caring for a patient with active tuberculosis notes that the N95 respirator supply in the unit has expired. Which action demonstrates safe practice? A. Continue using the respirators until new stock arrives. B. Replace the respirators and notify materials management. C. Use a surgical mask in place of the N95. D. Request that the client temporarily wear 2 surgical masks. Correct answer. B. Rationale. Expired PPE may not function properly. The RN must remove unsafe equipment and initiate replacement. A surgical mask does not protect against airborne TB. Question 6. A nurse witnesses a UAP given a client oral medications that were left at the bedside by another staff member. What is the nurse's priority action? A. Complete an incident report. B. Notify the nurse manager. C. Assess the client and obtain vital signs. D. Educate the UAP about medication safety. Correct answer, C. Rationale. The immediate priority is client safety. Determine if harm has occurred. Then the nurse must follow facility policy by reporting and documenting the event. Question 7. A client restrained for violent behavior becomes increasingly agitated and attempts to break free. Which action is the nurse required to perform first? A. Apply additional restraints for safety. B. Assess the client's airway, circulation, and mental status. C. Request a new restraint order from the provider. D. Administer PRN sedatives as ordered. Correct answer, B. Rationale. Safety and infection control includes protecting clients from injury and following restraint requirements. The RN must first assess physiological status to determine medical causes of agitation or restraint-related injury. Question 8. A nurse caring for a neutropenic oncology patient identifies which food item on the meal tray as unsafe. A. Fresh strawberries. B. Canned peaches. C. Cooked carrots. D. Pasteurized yogurt. Correct answer, A. Rationale. Neutropenic precautions require avoiding raw fruits and vegetables, which may harbor bacteria. Canned and cooked foods are safe. Question 9. A nurse is preparing to administer chemotherapy. While donning PPE, the nurse notices a tear in the chemotherapy-rated glove. What is the correct action? A. Tape the torn area and proceed. B. Request another nurse to assist. C. Replace the glove before continuing. D. Continue if only handling tubing. Correct answer, C. Rationale. Handling hazardous medications requires chemotherapy. Approve intact PPE. The glove must be replaced to avoid exposure. Question 10. A client receiving IV vancomycin reports new onset pruritus and flushing of the upper body. Respiratory rate is 26 per minute. What should the nurse do first? A. Stop the infusion immediately. B. Notify the provider of suspected allergic reaction. C. Administer prescribed diphenhydramine. D. Slow the infusion rate and reassess. Correct answer, A. Rationale. Sudden flushing and pruritus could indicate infusion reaction or early anaphylaxis. The RN must first stop the infusion to prevent worsening reaction, then assess and notify the provider. Question 11. A nurse is caring for a client receiving continuous enteral feeding via a pump. The nurse notes the pump is alarming for high pressure and sees that the tubing is kinked under the bed rail. What is the priority action? A. Stop the feeding and flush the tube with 30 milliliters of water. B. Reposition the tubing to remove the kink. C. Replace the entire feeding set and tubing. D. Increase the pump pressure limit and continue infusion. Correct answer, B. Rationale. A kink in the tubing creates back pressure. The safest immediate action is to remove the obstruction. Increasing pump pressure risks tube rupture. Flushing is unnecessary unless patency is in question. Question 12. A nurse enters a room and finds a client with advanced dementia attempting to climb out of bed while the bed alarm is turned off. What is the nurse's priority? A. Turn the bed alarm on and leave the room. B. Apply bilateral soft wrist restraints. C. Stay with the client and call for assistance. D. Move the client to a room closer to the nurse's station. Correct answer, C. Rationale. The client is actively at risk for falls. The nurse must stay at the bedside to prevent injury, then call for help. Restraints are used only after less restrictive measures fail. Question 13. A nurse caring for a patient on airborne precautions notices that the negative pressure room is not maintaining proper airflow. What should the nurse do first? A. Notify facilities/maintenance immediately. B. Move the patient to a different negative pressure room. C. Place a "Do not enter" sign outside the room. D. Ask the provider to discontinue airborne precautions. Correct answer: B. Rationale. Airborne isolation, e.g., TB, measles, requires functioning negative pressure. The patient must be relocated immediately to prevent airborne transmission. Maintenance is notified after patient relocation. Question 14. A nurse is caring for a client with a new surgical drain. The nurse notes that the drain suction has stopped and the tubing is clogged with thick debris. Which action is appropriate? A. Attempt to flush the drain to restore suction. B. Milk the tubing vigorously to remove blockage. C. Notify the provider and anticipate an order to irrigate. D. Replace the drain tubing per sterile technique. Correct answer: C. Rationale. RNs cannot irrigate or replace surgical drains without an order. The correct action is to notify the provider and anticipate further instructions. Question 15. A nurse receives a report that a client receiving IV potassium chloride, KCl, is complaining of burning at the IV site. What is the priority intervention? A. Document the client's complaint and monitor the site. B. Dilute the potassium infusion without a provider order. C. Stop the infusion immediately and assess the IV site. D. Apply a warm compress to reduce discomfort. Correct answer: C. Rationale. Burning can indicate IV infiltration or chemical phlebitis. Potassium is a high-risk medication. The nurse must stop the infusion and assess the site before any other actions. Question 16. A nurse finds a vial of insulin on the medication cart without a label indicating the date it was opened. What is the correct action? A. Label it with the current date and use it. B. Discard the vial and obtain a new one. C. Ask other nurses when it was opened. D. Store it in the refrigerator until the date is known. Correct answer: B. Rationale. Medications without proper labeling violate safe handling and storage standards. Insulin without a date is discarded to prevent administration of unsafe medication. Question 17. A client with a history of MRSA wound infection now has negative wound cultures. The provider discontinues contact precautions, but staff express uncertainty. What should the nurse do? A. Reinstate precautions until the infection control team confirms. B. Follow the provider's order and discontinue precautions. C. Continue precautions only when performing wound care. D. Call the charge nurse to clarify the order. Correct answer: B. Rationale. Discontinuation of isolation follows provider orders and facility policy. If cultures are negative and orders are clear, precautions can safely be removed. Question 18. A nurse preparing IV antibiotics sees that the medication bag has moisture and droplets inside the outer wrapper. What is the best action? A. Use the medication because the inner bag is intact. B. Send the bag back to pharmacy and obtain a new one. C. Dry the outer wrapper completely before using. D. Use the medication if the expiration date has not passed. Correct answer: B. Rationale. Moisture inside the wrapper indicates sterility breach. The medication must be replaced to maintain aseptic practice. Question 19. A nurse notices a staff member entering a client's room without performing hand hygiene. The client is immunocompromised. What is the nurse's priority action? A. Document the staff member's behavior. B. Immediately stop the staff member and reinforce hand hygiene. C. Report the issue to the unit manager. D. Ask infection control to provide education for the unit. Correct answer, B. Rationale. Unsafe practice must be intervened upon immediately to protect the client. Education and reporting occur after preventing the immediate risk. Question 20. A nurse is caring for a patient on droplet precautions. The patient needs transport to CT scan. Which action is required? A. The patient must wear a surgical mask during transport. B. Transport staff should wear N95 respirators. C. The nurse must accompany the patient at all times. D. CT staff must wear sterile gowns for the procedure. Correct answer, A. Rationale. For droplet precautions, the patient wears a surgical mask during transport to prevent spread of respiratory droplets. N95s are for airborne precautions. Question 21. A nurse preparing to insert a urinary catheter notices that the sterile gloves accidentally brushed against the side rail while opening the kit. What is the nurse's priority action? A. Continue the procedure while avoiding further contamination. B. Replace only the gloves and proceed with the existing kit. C. Discard the contaminated gloves and obtain a new sterile kit. D. Ask another nurse to assist with maintaining the sterile field. Correct answer. C. Rationale. The sterile field is contaminated when gloves touch a non-sterile surface. Because sterile gloves are part of the field, the entire kit must be replaced to maintain asepsis during catheter insertion. Question 22. A nurse notices sparks and a burning smell coming from an IV infusion pump. What is the priority intervention? A. Turn off the pump and unplug it from the wall. B. Remove the pump from the room and report the malfunction. C. Activate the nearest fire alarm. D. Move all clients in the area to another hallway. Correct answer, A. Rationale. The first step for small equipment fires is to disconnect the electrical source if safe to do so. Then the equipment is removed and reported. Activating the alarm is done only if the fire spreads. Question 23. A patient with Clostridioides difficile is being transferred to radiology. Which action is correct? A. Place the client in a surgical mask for transport. B. Ensure staff wear N95 respirators. C. Have the receiving department clean the transport stretcher after use. D. Clean the stretcher with bleach-based disinfectant after transport. Correct answer, D. Rationale. C. Difficile requires contact precautions and spore-killing disinfectants. Bleach after equipment contact. Masks and airborne precautions are not required. Question 24. A nurse finds an unlabeled, pre-drawn syringe of clear fluid on a bedside table. What should the nurse do first? A. Administer the medication if it matches the scheduled dose. B. Discard the syringe immediately using safe disposal. C. Ask the UAP if they know what it is. D. Request another nurse to identify the syringe contents. Correct answer, B. Rationale. Unlabeled syringes violate medication safety laws. The only safe action is immediate disposal, as the contents cannot be verified. Question 25. While caring for a client with a tracheostomy, the nurse notes bubbling in the humidification chamber has stopped. What is the priority action? A. Increase the oxygen flow rate. B. Check for disconnection or empty water chamber. C. Replace the tubing and humidifier. D. Notify respiratory therapy. Correct answer, B. Rationale. Loss of humidification is often due to disconnection or empty chamber, an immediate fix. Increasing flow may worsen dryness and damage the airway. Respiratory therapy is notified only if troubleshooting fails. Question 26. A nurse observes a UAP lifting a heavy patient without using a mechanical lift as ordered. What is the nurse's priority? A. Educate the UAP immediately about ergonomic safety. B. Report the unsafe practice to the nurse manager. C. Instruct the UAP to stop and obtain proper equipment. D. Assist the UAP to complete the lift safely. Correct answer: C. Rationale. Unsafe practice must be stopped immediately to prevent injury. Education and reporting occur after the immediate risk is corrected. Question 27. A nurse is preparing to administer chemotherapy via IV but notes that the tubing does not have chemotherapy-rated connectors. What is the correct action? A. Administer the chemotherapy using standard IV tubing. B. Delay chemotherapy until the correct tubing is obtained. C. Connect two standard sets to double reinforce. D. Use a filter needle to reduce exposure risk. Correct answer: B. Rationale. Hazardous medication administration requires chemotherapy-rated secure connectors to prevent leakage. The infusion must be delayed until proper equipment is available. Question 28. A client with a history of wandering attempts to exit the unit through a controlled access door. What should the nurse do first? A. Activate the emergency lockdown alarm. B. Redirect the client back to a safe area. C. Apply a waist restraint to prevent wandering. D. Notify security to escort the client. Correct answer: B. Rationale. The safest immediate action is redirection, a less restrictive intervention. Security and restraints are used only if redirection fails. Question 29. A nurse sees a medication order that appears to be written unclearly. Lanoxin 0.25 QD. What is the priority action? A. Administer the medication as interpreted. B. Clarify the order with the pharmacist. C. Contact the prescribing provider to verify the order. D. Hold the dose until next shift for clarification. Correct answer: C. Rationale. When a medication order is unclear, the prescriber must clarify it. Abbreviations like QD are unsafe and require correction before administration. Question 30. A nurse is preparing a sterile field for a dressing change. The nurse notes that the sterile solution bottle has been opened previously but is dated 48 hours ago. Facility policy states open bottles are safe for 24 hours. What is the correct action? A. Use the solution since contamination risk is low. B. Shake the bottle vigorously and use it. C. Discard the solution and obtain a new sterile bottle. D. Pour from the bottle only if used for non-sterile procedures. Correct answer: C. Rationale. Sterile solutions must adhere to facility expiration policy. Once the time frame lapses, sterility is no longer guaranteed. The bottle must be discarded and replaced. Question 31. A nurse enters a room and finds a visitor helping a patient with repositioning using the patient's IV pole for support. What is the nurse's priority action? A. Thank the visitor and encourage participation. B. Explain that only trained staff may assist with mobility. C. Ask the visitor to leave the room until staff arrive. D. Assess the patient for injury and assume responsibility for mobility. Correct answer: D. Rationale. The patient's safety is the immediate priority. The nurse must first assess for injury, take over the mobility activity, and then educate the visitor. Unsupported or unsafe mobility attempts can lead to falls or equipment damage. Question 32. During morning rounds, the nurse notes that a client on seizure precautions does not have padded side rails in place. What should the nurse do first? A. Place the side rail pads on immediately. B. Document the absence of pads as a safety risk. C. Notify the charge nurse and request additional equipment. D. Review seizure precautions with the UAP. Correct answer. A. Rationale. The lack of padding poses an immediate risk for injury. The nurse must correct the hazard first, then address reporting and education afterward. Question 33. A nurse caring for a client newly diagnosed with hepatitis. A receives a physician order for contact precautions. What is the correct response? A. Implement contact precautions immediately as ordered. B. Request the order be changed to airborne precautions. C. Clarify with the provider because standard precautions are typically sufficient. D. Place the patient in a negative pressure room. Correct answer. C. Rationale. Hepatitis A spreads via fecal-oral transmission, not contact or airborne. Standard precautions plus strict hand hygiene are used unless fecal incontinence or diapered clients are present. The order requires clarification. Question 34. A nurse notes that the temperature in a medication refrigerator is reading above the safe storage range. What is the priority intervention? A. Reset the refrigerator and recheck the temperature in 30 minutes. B. Move temperature-sensitive medications to another approved fridge. C. Notify pharmacy after the next medication pass. D. Document the temperature variance. Correct answer. B. Rationale. Temperature-sensitive medications can lose potency if stored incorrectly. They must be transferred immediately to a safe environment. Documentation and reporting follow. Question 35. A nurse is preparing to clean a spill of a liquid chemotherapy agent outside the medication room. What is the first action? A. Place absorbent pads over the spill. B. Obtain a chemotherapy spill kit. C. Evacuate the area of clients and visitors. D. Call environmental services. Correct answer. B. Rationale. A chemotherapy spill kit contains PPE and proper disposal tools required by hazardous drug safety protocols. Only trained staff should perform cleanup. Evacuation occurs if vapors or exposure risk is high. Question 36. A client receiving IV heparin suddenly develops swelling and coolness at the IV site. What is the nurse's priority? A. Elevate the extremity and apply a warm compress. B. Stop the infusion and disconnect the tubing. C. Slow the infusion rate and reassess in 15 minutes. D. Flush the IV site to reestablish patency. Correct answer. B. Rationale. Swelling coolness suggests infiltration. With heparin, a high-risk medication, the infusion must be stopped immediately to prevent further tissue damage. Flushing is contraindicated. Question 37. A nurse is hanging an IV antibiotic when the patient states, "That drug doesn't look like the one I got yesterday." What is the appropriate first step? A. Reassure the patient that antibiotics may come in different colors. B. Stop and verify the medication order and drug identity. C. Ask pharmacy if the manufacturer changed the appearance. D. Administer it after double-checking the patient's wristband. Correct answer. B. Rationale. Patient concerns must be taken seriously. The nurse must verify the medication and order before administration. This is a core safety principle. Question 38. A nurse checks the oxygen humidifier and sees mold growth inside the chamber. What is the nurse's best action? A. Empty, rinse, and refill the chamber with sterile water. B. Replace the humidification apparatus entirely. C. Notify respiratory therapy to evaluate later. D. Continue use if the oxygen flow is adequate. Correct answer. B. Rationale. Mold equals contamination. The entire humidification system must be replaced to prevent respiratory infection. Question 39. A nurse manager reports that several needle stick injuries occurred in the past month during medication preparation. Which action should the nurse expect to implement first? A. Conduct a unit-wide in-service on safe needle handling. B. Review and reinforce the use of safety engineered devices. C. Perform a root cause analysis of when the injuries occurred. D. Increase staffing ratios to reduce rushing. Correct answer. C. Rationale. Before interventions, leadership must identify the cause of errors. RCA determines whether the issue is equipment, workflow, staffing, or training. Question 40. A confused patient keeps removing their nasogastric tube despite redirection. The provider orders soft wrist restraints. What is the nurse's priority before applying the restraints? A. Assess circulation and skin integrity of the extremities. B. Explain to the patient why restraints are being used. C. Notify the family of the decision to use restraints. D. Document the patient's repeated attempts to remove the tube. Correct answer. A. Rationale. Before applying restraints, the RN must assess the extremities for circulation, skin integrity, mobility, and determine proper sizing. Assessment ensures restraints will not cause harm. Education and documentation follow. Question 41. A nurse is irrigating a deep wound using sterile technique. While pouring sterile normal saline, the bottle accidentally touches the sterile field. What is the priority action? A. Continue because the saline itself is sterile. B. Move the bottle away and continue using the field. C. Discard the contaminated field and set up a new sterile field. D. Ask another nurse to assist with maintaining sterility. Correct answer. C. Rationale. Contact between the bottle and sterile field breaks sterility. The entire field must be replaced immediately to prevent infection. Question 42. A patient with a history of alcohol withdrawal is becoming increasingly confused and climbing out of bed. The bed alarm is on. What should the nurse do first? A. Apply soft restraints to prevent harm. B. Move the patient to a room closer to the nurse's station. C. Remain with the patient and call for assistance. D. Administer PRN lorazepam per protocol. Correct answer. C. Rationale. The patient is actively unsafe. The priority is stay with the patient to prevent immediate injury, then call for help. Medication or environment adjustments occur after preventing harm. Question 43. A nurse notes that a client receiving tube feeding has a partially deflated gastrostomy tube balloon. What is the appropriate first action? A. Reinstate the balloon volume using sterile water. B. Stop the feeding and assess tube placement. C. Continue the feeding but tape the tube in place. D. Remove the tube and place a new one. Correct answer. B. Rationale. A deflated balloon can cause dislodgement, increasing aspiration risk. The nurse must stop feeding and assess placement before inflating or intervening further. Question 44. A nurse observes a new graduate entering an airborne isolation room wearing only a surgical mask. What is the nurse's priority action? A. Allow the graduate to finish quickly to minimize exposure. B. Immediately stop them and provide an N95 respirator. C. Notify the infection control department. D. Educate them about proper PPE after completing client care. Correct answer. B. Rationale. Airborne precautions require an N95 respirator. Immediate intervention is necessary to protect staff from exposure. Question 45. A nurse preparing to administer IV contrast for a CT scan checks the patient's allergy band and notes shellfish allergy. What should the nurse do first? A. Proceed. Shellfish allergies do not affect contrast use. B. Clarify the allergy and notify the provider before administration. C. Administer prophylactic diphenhydramine. D. Remove the allergy band if it is outdated. Correct answer. B. Rationale. The nurse must verify and clarify any allergy before administering contrast. Although shellfish allergy is not a contraindication to contrast, clarification and provider notification are still required for client safety. Question 46. A client is on neutropenic precautions. Which nursing intervention requires immediate correction? A. Placing fresh flowers at the patient's bedside. B. Serving prepackaged snacks from sealed containers. C. Performing hand hygiene before entering the room. D. Encouraging daily bathing. Correct answer. A. Rationale. Fresh flowers and plants can harbor bacteria and fungi, posing a serious infection risk for neutropenic clients. Question 47. A nurse is preparing a sterile field. While opening a sterile drape, a small tear is noticed on the outer corner of the packaging. What should the nurse do? A. Use the drape if the tear is not near the sterile contents. B. Use the drape only after applying hand sanitizer. C. Discard the drape and obtain a new sterile pack. D. Tape over the tear and proceed. Correct answer. C. Rationale. Any tear in sterile packaging compromises sterility. The package must be replaced immediately. Question 48. A UAP reports that a patient's gait belt is missing and asks whether they should assist the patient without it. What is the nurse's best response? A. Yes. Assist carefully and walk slowly. B. Wait until I can supervise you. C. Do not assist the patient until a gait belt is obtained. D. Ask the family to help with ambulation. Correct answer. C. Rationale. Ambulating without proper equipment increases fall risk. The UAP must not assist without a gait belt. Question 49. During a unit disaster drill, a nurse receives 4 clients for triage. Which client should the nurse prioritize? A. A client with an open humerus fracture and controlled bleeding. B. A client with mild smoke inhalation and normal oxygen saturation. C. A client with a penetrating chest wound and severe respiratory distress. D. A client with a sprained ankle reporting severe pain. Correct answer? C. Rationale. Disaster triage prioritizes life-threatening but potentially survivable injuries first. Severe respiratory distress from chest trauma is highest priority. Question 50. A nurse is about to administer insulin from a multi-dose vial. The vial label shows it expired yesterday. What should the nurse do first? A. Use the vial if it appears clear and uncontaminated. B. Administer half the dose to ensure safety. C. Discard the vial and obtain a new one. D. Ask the pharmacist if it is still effective. Correct answer. C. Rationale. Expired medications must be discarded immediately. Using expired insulin risks contamination and incorrect potency. Question 51. A nurse is caring for a client with a newly inserted PICC line. While preparing to flush the line, the nurse notices that the catheter length exposed is 3 centimeters longer than documented at insertion. What is the priority action? A. Flush the line cautiously and reassess. B. Stop using the line and notify the provider immediately. C. Resecure the dressing and continue monitoring. D. Pull the catheter back to the original length. Correct answer. B. Rationale. Increased external length indicates possible catheter migration, which risks embolus or malposition. The nurse must stop all use and notify the provider. Question 52. A nurse enters a patient room and notices a puddle of IV fluid leaking from a damaged IV bag onto the floor. What is the first intervention? A. Place a wet floor sign and call housekeeping. B. Stop the IV infusion and clamp the tubing. C. Don gloves and mop up the spill immediately. D. Move the patient to another room. Correct answer, B. Rationale. The IV must be stopped immediately to prevent harm to the patient and stop fluid leakage. Environmental cleanup follows after patient safety is ensured. Question 53. A nurse is preparing to administer medication via a patient-controlled analgesia PCA pump when she notices that the PCA settings displayed do not match the provider's order. What should the nurse do first? A. Administer a manual bolus to test the pump function. B. Reprogram the pump to match the order. C. Lock the pump and contact the provider for clarification. D. Stop the PCA and verify the previous nurse's documentation. Correct answer, C. Rationale. When pump settings do not match the order, the pump must be lock secured and the provider notified. The nurse cannot change settings without verification. Question 54. A client on droplet precautions is transported for an echocardiogram. The technician arrives without wearing a mask. What is the nurse's priority action? A. Provide a mask to the technician immediately. B. Allow the exam but keep distance from the client. C. Reschedule the procedure for a later time. D. Notify the nurse manager of the violation. Correct answer, A. Rationale. In droplet precautions, anyone within 3 to 6 feet of the client must wear a mask. Immediate correction protects staff and other clients. Question 55. A nurse discovers that the restraints applied to a confused patient were tied to the side rails. What is the nurse's first action? A. Retie the restraints to the bed frame. B. Document the incorrect application. C. Notify the charge nurse. D. Remove the restraints permanently. Correct answer, A. Rationale. Tying restraints to side rails creates a strangulation and fall hazard. Immediate correction is required before reporting or documenting. Question 56. A nurse caring for a client with suspected meningococcal meningitis receives the lab call confirming diagnosis. What is the priority intervention? A. Start droplet precautions immediately. B. Prepare for patient transfer to ICU. C. Send family members to the waiting room. D. Begin IV antibiotics before applying PPE. Correct answer, A. Rationale. Meningococcal meningitis is highly contagious and requires droplet precautions immediately to prevent transmission. Question 57. During central line dressing change setup, the nurse notices that the sterile drape has a faint water stain on one corner. What should the nurse do? A. Use the drape if the stain is dry. B. Cut away the stained portion. C. Discard and obtain a new drape. D. Place a second sterile drape on top. Correct answer, C. Rationale. Water stains compromise sterility. A new sterile drape must be used. Question 58. A nurse hears a bed alarm sounding and enters the room to find an elderly patient halfway off the mattress. What is the nurse's priority action? A. Assess the patient for injury. B. Activate the rapid response team. C. Reposition the patient safely to the center of the bed. D. Notify the provider. Correct answer, C. Rationale. The patient is in immediate danger of falling. The nurse must physically prevent the fall first, then assess for injuries. Question 59. A nurse preparing to administer an IV antibiotic observes that the IV tubing is labeled for parenteral nutrition use. What is the best action? A. Use the tubing because it can handle most IV fluids. B. Replace the tubing with standard IV medication tubing. C. Flush the tubing thoroughly before use. D. Administer the antibiotics slowly. Correct answer B. Rationale. Tubing labeled for a specific therapy, TPN, must not be used for other medications due to contamination and compatibility risks. Replace with proper tubing. Question 60. A client with a high fall risk has a spilled cup of juice on the floor. The UAP says they will clean it in a few minutes. What should the nurse do first? A. Remind the UAP to clean spills promptly. B. Clean the spill immediately to prevent a fall. C. Escort the patient to a chair until the floor is clean. D. File a report regarding safety negligence. Correct answer B. Rationale. A wet floor plus high fall risk equals immediate hazard. The nurse must correct the hazard first. Delegation and reporting occur after. Question 61. A nurse is starting a blood transfusion. After beginning the infusion, the nurse realizes that the patient's identification band is smudged and partially unreadable. What is the priority action? A. Continue the transfusion and verify ID verbally. B. Immediately stop the transfusion and obtain a new ID band. C. Ask family members to confirm the patient's name. D. Compare the patient's medical record number with the unit number. Correct answer B. Rationale. Blood product administration requires two clear patient identifiers. A smudged or unreadable ID band is an immediate safety risk. The transfusion must be stopped and ID properly reestablished. Question 62. A nurse observes sparks coming from the outlet where a patient's IV pump is plugged in. What should the nurse do first? A. Remove the pump from the outlet. B. Turn off electricity to the room. C. Evacuate the patient from immediate danger. D. Pull the hospital fire alarm. Correct answer C. Rationale. According to fire safety, RACE, the priority is rescue. Move the patient away from immediate danger before addressing the electrical hazard. Question 63. While preparing to administer a vaccine, a nurse realizes that the vial was left unrefrigerated for several hours. What is the best action? A. Warm the vial in the hands before use. B. Administer the dose if it is clear and uncontaminated. C. Discard the vial and obtain a new vaccine dose. D. Ask the pharmacist if it can still be used. Correct answer C. Rationale. Vaccines require strict temperature control. Once temperature safety is breached, the vial must be discarded, never used. Question 64. A nurse sees a UAP taking a blood pressure cuff from a contact precautions room without wiping it down. What is the nurse's priority action? A. Document the break-in infection protocol. B. Stop the UAP and disinfect the equipment immediately. C. Notify the charge nurse of the violation. D. Provide a unit-wide infection control education session. Correct answer B. Rationale. Immediate intervention is required to prevent cross-contamination. Equipment must be disinfected before leaving the isolation room. Question 65. A patient receiving TPN has a central line dressing that is loose and lifting at the edges. What is the priority action? A. Reinforce the edges with tape. B. Replace the entire dressing using sterile technique. C. Wait until the next scheduled dressing change. D. Call the provider before changing it. Correct answer B. Rationale. TPN poses a high infection risk. A loose dressing compromises sterility and must be replaced immediately using sterile technique. Question 66. A nurse is about to use a wheelchair to transport a patient and notices the left brake does not lock. What should the nurse do? A. Use the wheelchair while having the UAP hold it steady. B. Place wedges under the wheels to stabilize it. C. Remove the wheelchair from service and obtain a working one. D. Transport the patient only a short distance. Correct answer. C. Rationale. Faulty equipment is an immediate fall risk and must be removed from service. A fully functioning wheelchair must be obtained. Question 67. A client with suspected measles has arrived on the unit without wearing a mask. What is the nurse's first action? A. Put a surgical mask on the patient immediately. B. Escort the patient to a negative pressure room. C. Notify infection control. D. Instruct staff to don N95 respirators. Correct answer, A. Rationale. The first step is source control. Place a mask on the patient to reduce airborne spread. Then proceed with airborne precautions and room placement. Question 68. A nurse is withdrawing medication from a multi-dose vial when she realizes she forgot to scrub the rubber stopper. What is the priority action? A. Continue withdrawing the dose since the needle is sterile. B. Discard the needle and start over with proper cleaning. C. Inject antiseptic into the vial to disinfect it. D. Label the vial as contaminated and send it to pharmacy. Correct answer, B. Rationale. The nurse must discard the needle, scrub the stopper with alcohol, and begin again to preserve aseptic technique. Question 69. A nurse is caring for a client in bilateral wrist restraints. Which action requires immediate intervention? A. The client's fingers are cool and slightly pale. B. Restraints are tied to the bed frame using a quick release knot. C. The nurse documents restraint safety checks every hour. D. The nurse removes one restraint at a time to perform ROM. Correct answer, A. Rationale. Cool pale fingers indicate compromised circulation, requiring immediate release and reassessment of restraint placement. Question 70. A nurse is preparing a sterile field but accidentally turns her back to the field while reaching for supplies. What is the correct action? A. Continue the procedure, keeping hands above the waist. B. Check the field for visible contamination and proceed. C. Discard the field and prepare a new sterile field. D. Ask another nurse to verify sterility. Correct answer, C. Rationale. Turning one's back breaks sterility because the field can no longer be monitored. The sterile field must be replaced. Question 71. A nurse is assisting with a sterile dressing change. While donning sterile gloves, the nurse notices a small tear at the base of the right thumb after putting the gloves on. What is the priority action? A. Continue the procedure while avoiding contamination. B. Ask another nurse to assist with the sterile tasks. C. Remove gloves, perform hand hygiene, and don a new sterile pair. D. Cover the tear with sterile tape and continue. Correct answer, C. Rationale. Any tear in sterile gloves compromises sterility. The nurse must re-glove to maintain aseptic technique. Question 72. A nurse discovers that a patient on strict fall precautions has their bed in the highest position with all 4 side rails down. What should the nurse do first? A. Place all side rails up. B. Lower the bed to the lowest position. C. Apply a bed alarm immediately. D. Call for assistance from another nurse. Correct answer, B. Rationale. The lowest bed position reduces acute fall injury risks. The nurse then reinstates other fall prevention measures. Question 73. A patient receiving intravenous acyclovir reports burning and tightness along the vein. The intravenous site shows no redness or swelling. What is the priority nursing intervention? A. Slow the infusion rate. B. Dilute the medication further without a provider order. C. Stop the infusion and assess for extravasation. D. Apply a warm compress to decrease discomfort. Correct answer, C. Rationale. Acyclovir is a vesicant. Burning may signal early extravasation. The nurse must stop the infusion and assess immediately. Question 74. A nurse finds a visitor sitting in a patient's bed, eating from the patient's meal tray. The patient is on neutropenic precautions. What is the nurse's first action? A. Ask the visitor to leave immediately. B. Replace the patient's meal tray with a fresh one. C. Educate the visitor about neutropenic precautions. D. Notify dietary services of visitor contamination. Correct answer, B. Rationale. The meal tray is now contaminated and unsafe. Replace it immediately, then educate the visitor. Question 75. A patient with C. difficile is incontinent of stool. The nurse observes a UAP removing soiled linens and placing them directly into the hallway laundry cart. What is the priority action? A. Ask the UAP to double bag the linens. B. Instruct the UAP to place linens in a designated isolation linen bag. C. Tell the charge nurse about the incident. D. Remove the laundry cart from the hallway. Correct answer, B. Rationale. Soiled linens from a C. difficile room must be placed in isolation designated bags to prevent spore transmission.